I am Dr. Raywat Deonandan. I'm an epidemiologist and professor with the Interdisciplinary School of Health Sciences at the University of Ottawa.
Awesome, thank you. Um, so, my first main question is what is different about the flu shot this year?
Well, nothing particularly different about it from previous years, except that it incorporates a different combination of strains. So every year, a committee is struck that looks at what is circulating around the world, and they make an educated guess about what will be circulating around this time of year in North America. And the drug companies go out and they make the vaccine formulation for the season. Sometimes they get it better than previous times, so we're not quite sure yet whether this one's a good match, but I suspect it is. Um, that's how it works. So it uses old technology where the flu vaccine is grown in eggs, so it takes longer than the COVID vaccine. So we've kind of been spoiled these last 4 years with COVID vaccines coming out quickly because the mRNA technology is so much faster. But the flu vaccine uses an older technology, so it shouldn't be as scary to some people.
That's very interesting. I didn't realize that they were grown in eggs and that the technology was so different. I guess this is just a question on my end, but why would they continue to do it the old way if there's like a new,
Yeah.
faster way to get the flu shot out?
It's a good question. So, a lot of people are hesitant about the mRNA technology. That's why we have these huge anti vax movements. They think it's a new technology, an unproven technology. I don't think that's the case. It's actually a relatively older technology, and it's proven its worth and safety tremendously over the past 4 years. There is going to be a shift ultimately to using mRNA for flu vaccines because you can get a much closer match and you can manufacture them faster and at greater scale. So it will happen. It's just going to take some time.
So who should consider getting the flu vaccine?
Well, everyone should consider it. The people who are most at risk are the elderly and anyone with a chronic disease, especially a chronic respiratory disease. Sadly, though, the uptake has been traditionally poor in Canada. Uh, in last year, the uptake was about 42% of people, 43% in 2022. So it's always been in the 40s or so. Seniors last year, only 73% of seniors got it, and the goal is 80%. So seniors aren't getting it at all. And for adults with chronic medical issues, only 44% of those got it. So there is a very there's a low uptake in general, which is disappointing considering it has a good safety record. It's an old technology. We know what it does. We know how to deal with it if anything bad happens, and it's a pretty good vaccine.
So why do you think that is?
Well, surveys suggest that a lot of people, 43% actually, mistakenly believe that the flu vaccine gives you the flu. I hear this all the time. And that comes from the fact that maybe 1% of people will have an adverse event for the first couple of days after they get the shot. And that adverse event would be pain, maybe headache, maybe even a fever. And that feels like the flu. And people think, oh, it gave me the flu. It did not give you the flu. That's your own body reacting to it for a couple of days as it builds up an immune reaction. So there is that misunderstanding. And also, the flu vaccine doesn't prevent the common cold. So some seasons people get the flu vaccine, then they go out about their lives, catch a cold, and they think, hey, I thought I was immune. Clearly this thing's not working or it's making me sick. The flu and the cold are different things entirely. The flu will knock you on your ass, give you a bad fever, horrible pains. You don't want the flu. So that's the main thing. People think it makes them sick. A lot of people think it doesn't work, and that's unfortunate. The efficacy last year, uh, well, it depends how you compute it, but the ability to prevent symptomatic disease was between 40 and 50%, which doesn't sound extraordinary. That's pretty good, though. I mean, that's a coin toss of you not getting the disease aspect of the flu, which is a pretty good risk to me, and maybe 60% potential of keeping you out of the hospital if you do get it. So interestingly, it's not as potent as the COVID vaccines have been in the past, but it's a pretty good, pretty good potential of keeping you out of a bad outcome if you get the flu.
So we're seeing a fall surge for COVID-19 right now, but are we expecting to see the same thing with the flu?
We always see the flu surging in the winter months for a number of reasons, including that people are inside more and it's less humid, and so the virus transmit a bit more easily. So yes, we're entering flu season, as we call it. So we're going to see increased cases, absolutely. Now, you have to understand that the flu is no joke. I mean, it's not COVID levels of no jokedness, but it's not great. So last year we had about 74,000 cases in Canada, maybe 12,000 or so hospitalizations due to the flu, and maybe 3 to 4,000 deaths. It's hard to compute that. It's hard to separate the deaths that are caused directly by the flu and those that the flu kind of accelerated. But it does kill people. So people have to remember that this is a serious thing, and if you can lower your probability of getting really sick by it, why wouldn't you?
Yeah, absolutely. I also saw that children under 5 were high risk. I guess I'm curious if that's just because of their immune system or if it's because they tend to be around other kids as well.
Well, a combination of both, but usually it's about the immune system. Now, I'm not a pediatric expert, so I can't speak authoritatively about that. But my
Right.
understanding is that they are just more vulnerable anatomically and physiologically.
That makes sense. So, what would you say to someone who's on the fence about getting vaccinated for the flu? Because it seems like a lot of people are.
Yeah, I mean, I understand their hesitations to some extent. Nothing comes without risk. Okay, so this isn't a completely benign thing being jabbed into you. There is a small risk of you getting a little bit sick in the short term, maybe having some pain in your arm, maybe having to take a day off work if you have a bad reaction. Like I said, about 1% of people have that issue. And even rarer, much rarer circumstances, people get really, really quite sick from it and will end up being hospitalized. Something called Guillain-Barré syndrome, which is a neurological disease that it can trigger. And by the way, has a much higher, the flu disease itself has a higher potential of giving you that outcome than the vaccine. Keep that in mind. So it's not completely without risk, but the risk is minuscule and it can be managed, especially if you have good health care. So I would say to people, if maybe you don't feel that you're personally at risk, and it's probably the case. Most people don't have fear of the flu, but there are people in your lives that do have that vulnerability. The elderly, maybe there's someone in your life who has a chronic illness or immunosuppressant drugs, whatever it might be. You getting vaccinated increases the probability that this loved one of yours will not get sick. So do it for other people, if not for yourself.
Awesome. Thank you so much.
My pleasure.
Okay. Have a great day.
Bye bye.
Thanks for speaking. Bye.